What is health insurance here in Germany?
Everyone in Germany who stays here, who lives here for long term, needs a health insurance. And there are two types of health insurances. The DAK Gesundheit is one of the largest.
When I came to Germany for the first time, I had no knowledge that there's this Hausarzt concept here. Like you have to have a family doctor, you have to register yourself.
Indian students are insured with us, and I have often contact to them.
Okay.
And sometimes they ask me, they felt ill, and they directly went to the hospital, and they were wondering that the hospital refused them. And I have the impression that some of the students don't know that the first point of contact should be the family doctor and not the hospital.
Also, I'm curious, and this is a question for me. Sometimes I've seen a helicopter in Bielefeld and somebody tells me it's an ambulance. Is it true?
Yeah, it's true.
Yeah? So do we have like helicopter ambulances
We have helicopter ambulances.
Oh wow.
Yeah.
What decides how much a person has to pay for insurance?
The public system, the most things are regulated by law. If you decide now to get in the private health insurance, you must be aware that you might not have the possibility to switch back.
Hello and welcome to EaseGermany's podcast Pre-Spin Chat. Today we'll talk about health insurance. We have representatives from DAK Gesundheit, which is a very well-known health insurance provider here in Germany. What I'd like to know from you is what is health insurance here in Germany and how is it different maybe from other countries, or maybe you just explain how it works here in Germany, how insurance works.
Yes, so the basic is that everyone in Germany who stays here, who lives here for long term, needs a health insurance. And there are two types of health insurances. There are public health insurances, like the DAK Gesundheit, and there are private health insurances. And the most people in Germany, around about 88%, are insured at the public health insurance. And the public health insurance, the system works based on the solidarity principle, which means that everyone has a contribution to make, which is depending on the income. And everyone gets the same treatments, the same services. So like everyone is equal in the system and everyone can rely on the healthcare system. And the DAK Gesundheit is one of the largest companies in the health insurance, in the public services. And the DAK Gesundheit is also 250 years old, so one of the experienced health insurances in Germany.
Oh, that's nice. And I've also heard that, and now I know it, that health insurance is completely mandatory in Germany. Even for students who come from international countries to Germany, they have to get a health insurance before they come here. It's even mandatory before they apply for their visas. Is it true? Is it mandatory in Germany?
Yeah, it is mandatory. So every resident in Germany must have a health insurance, but not every person is covered by statutory health insurance. So if students come to Germany, for example, and the student is already older than 30 years, he's not covered by statutory health insurance. So there's no possibility for these persons to become member in a statutory insurance company. But every person must have an insurance. Yeah, this is the mandatory thing.
Okay. Thanks. When we were talking about public health insurance and private health insurance, can you explain a little bit what's majorly the difference between both of them and what would be better choice for students, especially international students?
Around about 90% of the population in Germany are insured in statutory health insurance, and most of the people have no choice. Yeah, some special groups of persons are not eligible to be insured in the statutory insurance. They must apply for a private insurance, for example, civil servants or police officers, or judges, for example. But usually students or employees, they are all insured in the public health insurance system. And this is I think it is the better system.
Mm-hmm.
It is much easier for the persons. You will receive an insurance card, and the doctors bill the costs directly with the insurance company. And if you are insured in a private insurance company, the doctors send the bill to the patients.
Okay.
So you have to pay the costs, and you have to send the invoice then to the insurance company for reimbursement.
Okay.
Yeah.
But with the public healthcare system, it's like directly from the insurance provider, yeah? You don't have to pay the invoices, directly help with the insurance provider.
Yeah, you just have to present the insurance card at the doctor, and the costs are directly billed with us. So
it's more convenient, yeah?
This is more convenient.
And that's why we'd also say it's better for international students also, because of the convenience, yeah. So we talk about public and private insurance and what's best for international students, and then we came because of the convenience, it's better for the students to go for a public health insurance provider. Now, one big question which also hangs around, and which is also, I think, especially for international students, is a main factor while they choose a health insurance provider, is the cost of insurance. And also, why is there I've known the system now, so I see that private insurance and public insurance, they also have very big difference in their costs. Can you explain a little bit why is there a cost difference, and what decides how much a person has to pay for insurance?
Of course. In the public system, the most things are regulated by law. So it's the same for the costs. Usually everyone pays the contribution depending on their income. But for students, there is a special tariff. If they are under 30, they can get the student health insurance, for example, at DAK Gesundheit, and then the costs are lower than usually. That's also regulated by law in most part. And in the private health insurance, it's different. The private health insurance has a different kind of pricing, because they decide which cost it may be depending on your age, depending on whether you have any illnesses, or whether you are the only one insured, or you have maybe a family member that is also insured. That would additionally cost you a little bit more in the private sector. So that's the main difference. But this also means it's a great risk for everyone who is insured in the private sector, because often in the private health insurance, the costs are rising with age, with illnesses. Mm-hmm. So if you are healthy now, this would mean maybe now you are paying a little bit less, but in future, if you maybe get an illness, it could mean for you that you will have to pay much more then.
Okay.
And this is a kind of a risk, because it is very hard to change from private to public insurance. So it's a kind of a long-term decision. And if you decide now to get in the private health insurance, you must be aware that you might not come back. You might not have the possibility to switch back.
Okay.
Therefore, you really have to think about it. And in public health insurance, as already mentioned, the treatments are the same for everyone. And the contribution will always depend on your income, so that you won't have a risk like this.
So if I understand it correctly, in a private health insurance, the amount of money a person pays depends on their age and the illnesses, and if other people are also insured by the insurance.
Yes.
But whereas in a public sector, it just solely depends on your income, and everything is covered and is equal for everyone, yeah?
Yeah, and another important thing is, in the private insurance, you have to pay premiums for each person.
Okay.
In the statutory health insurance, if you are married and you have children, these persons are maybe entitled for free family insurance. You don't have to pay any premiums.
Wow.
And in the private insurance, you have to pay money for every person. So
Amazing.
you have to think about this if you if you decide for a private insurance, and if you know already that you're planning to start a family, then I would not make a private insurance.
Yeah, that is amazing. And also, you just mentioned that if you switch to a private insurance, then you might not come back.
Exactly.
Usually there's no way back.
Okay.
So, for example, if you are a student and you're older than 30 years, then you can make a private insurance. And there's only a possibility for return to statutory insurance if you become a subject, if you are covered from the statutory insurance, for example, as an employee.
Mm-hmm.
So if you start an employment and you're not yet 55 years old, then you can you have access to statutory insurance.
Okay.
Mm. But there are also very defined rules for that. So in this case, we would also suggest to just contact us, and then we offer our help.
Mm.
But to keep in mind, it is really hard, and we already experienced it a lot, that people are coming to us because they want to switch back to the public insurance, and mostly the reasons are that they have to pay a high contribution in the private insurance, and there are many cases when they don't get to switch back to the public insurance. So it's really hard to come back. And so therefore we would of course recommend to inform yourself before you get insured very well. And in the public insurance you won't have any risks like this, so that would be the benefit of the public insurance.
Yeah, I mean, I do understand it, because especially for international students, there's so much at stake. They are moving to a different country, new country, they don't know the rules. So it's really important for them to choose very correctly which kind of insurance should they opt for, because every month they have to, pay for a contribution for the health insurance. So it's very crucial that they pay to the right person or the right healthcare provider, because they have to be insured, and health is, I think, really most important thing for any human being. And while students, they still choose health insurance provider when they're in their own home countries, when they still have not gotten here. What do you recommend? What should they consider before, choosing one healthcare provider over the other? What are the things to remember, and how to compare them? Do you have any things to say?
Of course.
Yeah.
Especially if you are looking for a public health insurer, please don't just look at the price, but also at other factors, because the pricing will only be slightly different. So there are only small differences in the contribution rate that you pay in the public health insurance, because the public health insurance is mostly determined by law. So there are a lot of things that are the same, but there are special on-top services. For example, you can have a look on whether your insurance has special services for you, whether they have a bonus system where you might get a valuable cashback, for example, if you are in a sports membership, or if they have a special offer for students. So I would always recommend to of course look on the websites, but also you can call us so that we may consult you. And for example, the DAK has special offers. So of course we have, for example, an English hotline. Markus is part of the English hotline, so
if a student
he knows
calls,
best.
they might be talking to Marcus.
Yeah.
Exactly, and of course that means that you have someone that you can talk to if there are any questions. I think that is really important, because there are so many different treatments and possibilities in health insurance, and therefore it's always best if you have someone that you can call and ask about it. And in addition, there are also some special tariffs or special offers, like, for example, the DAK Gesundheit offers to reimburse up to 100% of your vaccination if you go on a private trip. outside of Germany. So if you want to go on holiday, for us it's also important that our customers are healthy when they are on their holiday. Therefore, we pay up to 100% of these vaccinations. For example, we have a bonus system where everyone can get €50 per year for a membership in a gym or for a sports membership in a sports club. So there are a lot of possibilities to get a cashback. And in addition, there are also some tariffs where you may also get a valuable cashback. So there are a lot of different possibilities. And therefore, it's always best to just contact the health insurance itself. And for the DAK, I can say we are also happy to help you to find the right possibilities so that you have the best options for you.
That's really amazing, because as a healthcare provider, it's like you guys are also promoting or helping the people or students or whoever's connected with you to improve their health by these programs. Like you give some money back if you're associated with a fitness studio or gyms or some kind of sports activities. This is also very nice because maybe money is the motivation or something else, but because of that, students or people might go to gyms maybe just because of the bonuses or something, but they will end up doing some healthy stuff. And also because I myself am an international student and my master's program was completely in English, so I was not obliged to learn German before coming here. Similarly, there are many students and many more study programs are now being conducted in English. So students are not obliged to learn German before they come here. We still do advise start learning German back in your home countries. It's always better. But then these services, like you have this English hotline for people, this is really helpful, especially for international students, because they don't have to be worried, okay, how will I be able to get the most crucial information about health care, na? Because medical facilities, maybe there's an emergency or these kind of stuff, it's really crucial to have somebody you can have a conversation in English and you don't have to worry about how will I get to speak. That's really amazing. And now if a student has gone through the stuff, has compared their health insurance providers, and they now want to apply for a health insurance, what are the basic requirements or stuff that a person or a student has to come up with, whether documentation or maybe stuff for applying for a health insurance?
So we recommend that you apply for membership as soon as possible.
Okay.
For students, as soon as you receive the admission letter from the university. And if you like to start an employment in Germany, you can apply for membership with us as soon as you have made your working contract with your German employer. We receive every semester lots of applications for membership just 1 or 2 days before the start of the semester. Then we are very busy, and because it is necessary that the health insurance company transmits an electronic notification to the university. So this is very important. So you cannot enroll at the university without health insurance.
Oh, wow.
The first thing is to apply for membership with an insurance company. Then we will transmit an electronic notification. It is called M10 to the university, and then you can enroll.
Oh, wow.
And it takes usually 2 or 3 days for us to process the data if we receive the application for membership. So we are really glad if we receive the applications a little bit earlier.
I mean, that's only beneficial for the students. Their application, their enrollment in the university is delayed if they wait for the last moment to apply for a health insurance. So it's for their benefits.
This is possible if you receive the admission letter from the university, even if you still live abroad in India or in Africa or wherever. You can apply easily for membership online.
Yeah.
And
I did so.
And as soon as you arrive in Germany, it is important that you register at the residence registration office. So here at the city administration in the town hall. And we need a certificate of registration to establish the membership.
Okay, so it's like once they enroll in the program, when they're in their home countries. Then you inform the university, and then the students come here.
Yeah.
Then they register themselves at the town hall or the Rathaus or where they do their registration, and then they get their health card.
Yes, we need also a passport photo.
Okay.
Yeah, it is an obligation in Germany that on every health insurance card there must be a photo, that the staff in the doctor's surgeries can identify the patients. And as soon as we have the German address of the student, then we will send a letter to him or her and ask them to transmit us a photo. You can upload this on our website. It's also possible very easily online. And usually it takes, if we receive the photo, 1 week for the customer to receive the insurance card. It is not, if it is not possible for us to issue the card in time, then we issue an certificate by letter. You can present this to the doctor and you can be treated.
Oh wow, that's amazing.
Yeah. So this is no problem if you receive the insurance card some days later after you started with your studies.
That's perfect. So if all these documents that you just mentioned, you provide them as soon as you have them, and then your health insurance is you get the insurance card and it's started and you're already covered by health insurance. Perfect. I also wanted to ask, for students also, employees also who come here, sometimes the premium amount that they pay, it changes. I want to know, when does it change? Does it change with the change in visa category? So when students, they're done with their studies and they start their employments, does it change then, or how is it?
The kind of visa is not relevant for us.
Okay.
So if you are insured as a student in statutory insurance and you start an employment, then it depends on the working hours. If you work more than 20 hours a week regularly, then your employment is the subject to your statutory insurance.
Okay.
That means in this case your employer will debit the contributions as a percentage from the gross salary. They will deduct the money directly from the salary and pay the amount to the health insurance, and the student don't need to pay directly to us.
Okay.
But if you make, for example, a mini job, for example, 10 hours a week, so less than 20 hours, then you have to make sure the payment.
Okay.
So the employer will only pay contributions to the pension insurance, not to health insurance in this case.
Okay.
Yeah.
So it's like, as students, you're only allowed to work 20 hours a week. So you are not officially allowed to work more than 20 hours. But if you somehow do, then your employer will pay for the health insurance.
Yeah, that's right.
But if you work under 20 hours, let's say a mini job, then a student has to pay it themselves. Yeah. And the employer only pays for the insurance in pension insurance. Yeah.
Pension insurance. Yes.
The health insurance a person or a student has to take care of themselves, and it does not depend on the visa category, as you just mentioned. So, perfect. When students finally come here to Germany, what are the very first steps that they get to access these medical services, get to a doctor? What are the first steps that they have to do?
The first step should be to apply for an insurance.
Yeah.
So it is essential to have health insurance and to have an insurance card. Yeah. So if you receive the card, you can just present this card to the doctor and you will be treated.
Okay.
So this is very easy.
I've also seen, even in medical stores, we go and take your medicines, apothecary. You also sometimes, give your health insurance card and the prices are reduced. You don't have to pay the whole price maybe.
If you need medicine, the doctor will issue an electronic prescription. This is stored in a central cloud, and you can go with your insurance card to the pharmacy. And the pharmacy can use the information stored by the doctor, and you will receive the medicine. And you have to make an additional payment for medicines. These are 10% of the costs, at least €5, maximum €10.
Oh, perfect, amazing. Also, like when I came to Germany for the first time, I had no knowledge that there's this Hausarzt concept here. Like you have to have a family doctor, you have to register yourself. And I mean, you guys are the best experts now. Explain to me, what is this Hausarzt system? Why is it necessary for everyone, you know? And why, like, it's always the first point of contact whenever you need some kind of medical services, you have to go to your Hausarzt. Explain the concept to me, because it's not there in India usually for us, but it's completely a new thing that I came to know when I came to Germany.
Yes, it's very important to have a Hausarzt, or also called family doctor or general practitioner. So if you have any illness, your family doctor will always be the first contact point. So he also gives you a referral, for example, for clinics or for specialists. But he is somehow like the guide in the healthcare system. So he's really, or she is the first point where you could go to if you are ill. And of course, there might be also times when your family doctor is not available. In these times, you, for example, can call the 116, 117, and there are also additional, how's it called?
Emergency
Hotlines.
Stations.
Emergency doctors' surgeries.
Okay.
Yes.
Notfall.
Especially in major towns. I'm not sure if it is here, for example, in Lemgo, but in Bielefeld you will find it. And if your Hausarzt, your family doctor, has already closed his surgery and you have acute problems, you can go to this surgery and you will be treated. These surgeries are usually open until 10 o'clock in the evening or sometimes until midnight. But in life-threatening situations, you should dial the number 112, and the operator will decide what to do. Maybe they will send an ambulance to you.
I mean, the Hausarzt usually, when they practice in their clinics, they have their official working hours. So it's like maybe till 4 p.m. or 6 p.m.
Yeah.
What if somebody gets an illness after that? Then they have to go to these emergency departments, as you said, yeah? Or maybe if it's very critical, then call the ambulance or the hotlines.
You can dial this number 116, 117. This is a special patient hotline. And you will receive information there which doctor is on duty on this time. And if you're not... if you cannot go to the doctor, for example, if you're injured and you are not ready to walk, then the operator can initiate that the doctor will visit you at home.
Okay, wow.
So
That's
really
amazing.
only in emergencies it's 112.
Okay.
Yeah. So only for life-threatening situations, if really someone is in great danger, then you call 112. And then they will ask about the whereabouts and send help there.
Yeah. I mean, sometimes I go trekking in the mountains or the forest, and then I see these signs with a special number, maybe on a tree or something. Then one time I was with a senior person and I asked them, what are these numbers? Why are they significant? Then they told me that these are the geolocations. For example, somebody gets hurt or somebody's in emergency situation. You tell these people that this is the point where we are, so that they can come reach you. I find it really interesting. But also, like for me, when I came here, I had no knowledge that I have to go register with an Hausarzt, yeah? And then even if I know it, how do I come to find out where to find one? And how do I get the first appointment if I have no knowledge of German? How to find an Hausarzt when students especially come here for the first time? Do you guys also like help people that are associated with you to find a Hausarzt? Do you provide a list or something?
Yes, of course. Of course, we can provide a list, but we also have an online service on our website, DAK. We have also a service where you can look up a family doctor. So there you just need to enter your postal code, and then you will see all family doctors that are nearby. And you also have the possibility to pick a language preference. So you could also say that your language preference would be English. So the system can help you to find the right doctor. But of course, we are always there. So of course, you can also call us, and then we may help you find a doctor. But we would recommend really to look for it as soon as possible, because in the case if you are ill, often one doesn't have the time. So it would be better to look for a doctor as soon as possible, that you know where you can go if you are ill.
Yeah. So we would not recommend to wait until you get sick or ill to find yourself an Hausarzt. You come here, you do it immediately in the initial days so that you're safe and you already have an Hausarzt, your family doctor.
Exactly.
Because as you mentioned, your Hausarzt or your family doctor is the one who will refer you to some specialist. Maybe you have some pain, some joints, some skin problem, then they are the one who will refer you, and you cannot directly go and interact with these doctors, which was I learned it the hard way. I went straight to a skin doctor and they said, you can't come here, you go first to your Hausarzt, they will refer, and then you come here. But it's good now, the students know.
Yeah, in some cases you can also go directly to the specialist, but it is always better or the safer option to first go to your family doctor, right?
100%.
Yeah.
And I mean, nowadays, most of the doctors we can find who are speaking fluent English also. So I learned German, so now I can have a conversation in German with my doctor. But in the earlier days, touch wood, I didn't have to go very often to the doctor, but sometimes in the initial days, it was completely okay to having a conversation. And as you said, at your platform, we can also shortlist doctors who are fluent in English or are okay with other languages. So it's really helpful for the international students, especially in their initial days. Yeah. Also, I would like to know, in a standard health insurance, what major things are covered? What are all the services that are covered in a health insurance?
So generally, the medical treatment in Germany is free of charge. You just present the insurance card to the doctor and you will be treated. The doctor can issue prescriptions, for example, for remedies such like physiotherapy or medicine. Yeah, for some benefits you have to make an additional payment. So these are only partially covered by statutory health insurance. Yeah, but generally the medical treatment by the doctor is free of charge.
Okay. So there are some services for which a student or a patient has to pay a little bit of amount, which are partially covered by the health insurance provider, yeah?
Yeah, for example, inpatient treatment in a hospital.
Okay.
If you need to be treated in a hospital, you have to pay 10 euros for each day.
Okay.
Maximum for 28 days in a calendar year.
Okay.
So the maximum amount is 280 euros.
Okay.
If you need to be treated for a longer period in the hospital.
Mm-hmm.
Yeah.
So for major surgery, where I hope nobody gets it, but if a patient has to go, a student has to go, so they have to pay just 10 euros a day, and the rest is covered by the health insurance provider.
That's right.
But the general practitioners or the clinics they visit, it's completely covered. Are there also some things that are completely not covered that a person has to pay completely for themselves?
Yes, a lot of doctors offers additional treatments which are not covered by statutory insurance. So I have the impression that some doctors have a special view to their profit.
Okay.
And some kinds of treatments, for example, are scientific not proven yet, and some are unnecessary. Yeah, and especially specialists offer these treatments which are not covered by statutory insurance. But it is important to point out that the doctor must inform the patient before the beginning of the treatment if a treatment is not covered. So the doctor must advise the patient about the advantages and the costs of the treatment, so the patient can decide, do I like to make this treatment or not?
Okay.
Yeah.
So if there are some things or some treatments that are not covered in your health insurance, it's the doctors are obligatory to inform you in advance whether you want to proceed it by paying it yourself. So usually a person who has a health insurance does not have to worry about costs. If there's a cost that he has to pay or she has to pay, they will be informed in advance.
Yeah.
So if somebody coming to Germany wants to have a plastic surgery done, they must have to pay themselves, yeah?
Yeah.
Yeah, but as already mentioned, the doctor has to point it out. So the specialist who wants to sell this treatment also has to inform you. And therefore it would be best to then also ask after the advantages and the risks of this treatment. And you can directly ask your doctor about the costs too.
Okay. So if I wanted to look like Marcus, have my plastic surgery done, I most often have to pay it myself. DAK won't.
Exactly.
Or
Yeah.
another important thing is the treatment from the dentist.
Yeah.
Yeah, if you can go for a checkup to the dentist once in a calendar half year, so every 6 months, you can go for a checkup to the dentist. This is free. And but if you need, for example, a dental filling, then you have maybe an additional payment.
Mm-hmm.
So every dentist must offer a filling material without an additional payment. But sometimes I think it is better to make an additional payment, because if you choose a higher quality of the filling material, it will
be beneficial for us only.
Maybe it lasts longer or something like this.
Yeah, it lasts longer. Yeah.
So in some cases it can really make sense to make an additional treatment, but often the treatments are offered although it's not necessary. So you really have to think through it. So think about it, whether this makes sense to you or it doesn't make sense to you to do it. And for this additional treatments and additional costs, in Germany, everyone also can decide whether he or she wants to have an additional insurance. So there are special add-on insurances, which you can also buy, but not from DAK, but from other private insurers. Even if you are insured at DAK Gesundheit or at any public health insurance, you can always do additional insurances.
Okay.
So that is very important. Many Germans, for example, have additional insurances for dental treatments, or if they want to see a chief physician in the hospital, for example, or if you, in the hospital, if you want to have a private room. These are things where you, for example, could use an add-on insurance that you can do additional to your public insurance.
Yeah, I mean, I myself have bought this health insurance, not health insurance, it's a third-party insurance. So if in case some accident happens or I have to pay some kind of damages, so this insurance takes care of it. So it's like very small amount, 5-6 euros I have to pay, but I'm insured. So if, let's say I hit a car by mistake or something I somehow damage it, it's insured by the insurance. Like, let's say I'm walking on a street and I hit a car by mistake.
Okay.
Now I have to pay this damages.
Yeah.
Do you know the term, the German term for this insurance?
It is Haftpflichtversicherung, I think.
Yes.
Yeah, could be, But it's not that expensive.
But it's not available in
DAK.
statutory health insurance.
But
DAK.
it's something you have to buy it yourself. Perfect. Also, when students or people insured with German health insurance, statutory or public health insurance, when they visit other European countries, European Union countries, or maybe in the neighboring countries, are they also insured over there, or can they bring their receipts and cash in and say we want some kind of reimbursement? Is it also so?
Yeah, we recommend to take out a private travel insurance before starting a trip abroad. This is a very important thing. If you travel, for example, to Asia or Africa, the DAK insurance card is not valid, so you cannot use it. The health insurance card of the statutory insurances like DAK are valid in all memberships, in all countries which are members of the European Union.
Okay.
Yeah, but even in these countries, it is possible that you have to pay costs.
Okay.
Let me give you one example. A few weeks ago, I talked to a woman from. She spent her holidays in France, and she unfortunately got seriously ill, and she needed to be treated in a hospital. And she presented her DAK card, and she thought every costs are covered. And a few weeks later, she received an invoice from the hospital from France, about 2,000 euros. And if you use the insurance card in another country, the insurance law of the country in which you are staying applies. Yeah, and in France, it is mandatory that the patients have an additional payment of an amount of 20% of the costs for the treatment in the first 4 weeks.
Ah, okay.
Yeah.
Wow.
And we are not allowed to reimburse these costs.
Ah,
So this
okay.
woman was very happy that she had that she made a private insurance before, so she could send the invoice to them and they reimbursed it.
Mhm.
But this is very important to take out a private insurance additional, even when you're traveling to a member state of the European Union.
Ah, perfect. Like, this is amazing. I think we have covered everything, every crucial topic we had to about health insurance, public, private, and how an international student sitting back in their home countries can now perfectly choose what's best for them. And as we also mentioned, it's not just about the cost, it's also about the benefits that they get, because it's not that very different kind of health insurances. Also, I'm curious, and this is a question for me. Sometimes I've seen a helicopter in Bielefeld and somebody tells me it's an ambulance. Is it true?
Yeah, it's true.
Yeah? So do we have like helicopter ambulances
We
here
have,
in
we have
Germany?
helicopter ambulances.
Oh, wow.
Yeah. If you have a case of emergency and you dial the number 112, the operator decides if it is necessary that the helicopter comes to you. They will arrange this.
I hope nobody gets ever sick and has to go in an emergency situation, but how cool will that be, going in a helicopter? In India, I don't think most of the people or the population do have a health insurance, and it's not compulsory as it is here in Germany. My mother, she works in an insurance company, so we are all covered by health insurances, and it's more like a life insurance. But still, because of her employment, we are all covered in health insurance. So if we have to go to a hospital for a major surgery or something like that, it's all covered. Even if we go to an MD doctor and we have to do some tests, some expensive reports must be made, some blood samples, x-rays or MRIs, then all these things can be reimbursed. But it's not like you present your health insurance card and then you don't have to pay anything. Maybe I would be surprised if we have a new insurance now where we have this kind of stuff. But not everyone is insured. How usually things happen in India is if somebody gets sick, they directly go to a clinic in their nearby area, or if they have a favorite doctor, they go directly to the doctor. Sometimes they make appointments before going there, or usually it's like you just show up at the clinic, you wait for your turn, you meet the doctor, they prescribe you, and then that's it. Yeah.
So a lot of Indian students are insured with us, and I have often contact to them.
Okay.
And sometimes they ask me, they felt ill and they directly went to the hospital, and they were wondering that the hospital refused them. And I have the impression that some of the students don't know that the first point of contact should be the family doctor and not the hospital.
Yeah.
Yeah, this is important to say, that only in cases of emergency, if the family doctor is not available, yeah, then you can go to a hospital or to an emergency surgery.
Mm-hmm.
Yeah.
And also you just told about 116 and 117. Are these the hotlines to call before you go there? Yeah. If, in case your Hausarzt is not,
It's not available, yes.
Yeah. Perfect. No, this is especially like, I can talk about India. This is not the case. You get sick, you go to the doctor, that's it. There's no appointments, and any doctor you like. So if you think you have problem with your bones, let's say you have a knee injury, you don't have to go to a general practitioner and they advise you go visit an ortho. you just go directly to an ortho doctor and you say, okay, my knees are hurting. So you can go directly to a specialist. So it's completely different, and now I get it. But it's good that students know this before coming here.
Yeah.
That the first point of contact should be their family doctor, and then they will write you and they will refer you. Now you can go. Yeah.
Yeah, but in some cases you can even go directly with the insurance card to the specialists and not to the family doctor.
Okay.
For example, if you have problems with your eyes, you can go to the ophthalmologist, I think is the English word.
Yeah. Eyes doctor.
Eyes doctor, yeah.
Yes.
It doesn't make sense to go to the family doctor if you have problems with your eyes.
Yeah.
He cannot help you.
Yeah.
And or if you have a broken leg, you can go directly to the orthopedist. Yeah.
Okay.
But in other cases, you should go at first to the family doctor.
Perfect. Thank you so much. Also, recently I've seen this change here in Germany for especially when you go visit doctors. Earlier, I used to get this script where the doctor used to prescribe some medicine or whatever they had diagnosed, and then I could have this physical slip. Nowadays, I don't get it. I think it's directly in my card. Is it so?
No, it is not stored in the card. It is stored in the central cloud.
Okay.
But the pharmacy can see these data with the insurance card, but it is not stored directly in the card.
Okay, and now I also received recently a notification about this EPA something. It's like all the medical history can be stored and is accessible to the doctors. It's more convenient. What is it?
Currently, from the beginning of this year, the electronic patient file, the German word is elektronische Patientenakte, or the abbreviation EPA.
Mm.
This has been introducing now at this time. So every doctor has to save the reports of the treatments in an electronic file. So there is the advantage if you are treated by several doctors, for example. The second one can see what the first doctor already did and which illnesses are determined, and so they can avoid that, for example, one doctor prescribes any medicines which are not compatible to a medicine another doctor prescribes. Yeah, so this is very helpful, I think, for the patients.
Yeah.
And
I mean, I received this letter and it was like, do you want to apply for it? I'm like, obviously, how convenient would this be if, as you said, if there are multiple doctors who had to see your case or had to operate on you? It's very easy for the doctors and for us also. Like, I don't have to carry all those paperwork and show, okay, this was the diagnosis and this is what they've already done. It's very convenient for now, and everything's going online finally. Yeah.
Yes.
But I think it's very convenient. So if any student would like to opt for DAK services, how can they contact you sitting back in their home countries?
You can contact us through several possibilities. For example, you can call us, you can go on the DAK website, you can chat also on the DAK website, or if you are already member of DAK, you could also use the DAK app, for example. There you can also video chat with us, or phone us, or just write like something like a mail. So there are many different ways to get in touch with us.
Perfect.
And if you like to communicate in English with us, you can dial our special hotline number. You will find the number also on our website.
Yeah.
Yeah, and if you dial this number, you can be sure that your contact partner is able to speak English with you.
Perfect. That's most convenient, especially for international students. Amazing. And also, if you get to video chat, maybe you guys will be on assisting students.
I think Marcus will do this.
All right, guys. Thank you so much again, and have a nice day.
Thank you.
Same to you. Thank you.